in large part, the decisions that they make and the decisions that you make. So, on the one hand, no one's going to be able to say in the future, you guys, the government did a lousy job. Sometimes the government does do a lousy job. The most important thing is to take command of your health. Take command of your health, take charge of your health, and take charge of the health of the people around you. You have the opportunity to do it. You have the power to do it. You have the power to do it. We used to say you had the power to do it because you had a computer. Now you can do it on a handheld telephone or whatever you hold in your hand now. You guys know these devices, there's virtually nothing. 5, 10 years from now, you're going to have the whole world, any information you want in the palm of your hand. You're in charge. It's a great responsibility, and it's a fantastic opportunity. I wish you a lot of luck with that. Thank you.
Good afternoon. My name is Matthew Dean. I am a senior at University School. Today at the City Club of Cleveland Youth Forum, we are listening to Rear Admiral Steven L. Solomon of the Centers for Disease Control and Prevention. Now we would like to return to our speaker for our traditional questions and answers. To ask a question, and it must be questions only, please raise your hand. As a courtesy, please stand, state your name and school, and hold your applause until the end of our program. Our microphone holders are Yush Kadia from University School and Abby Kolk from Hawkins School. First question, please.
We'll get this started. I have a couple questions that sort of relate to school programs.
Sure.
Is putting sort of like weight loss programs or diet programs into schools part of the public health departments, what they do? And then also, that's sort of one question. And then another separate question, but still related to schools, is I've heard stories about homeschooled children maybe not receiving the same vaccinations. And then, if you could talk a little bit about, the pros and cons of that, and anything related to that.
Yeah, those are two terrific questions. One, the first about the programs in the schools varies tremendously from state to state and county to county. I don't know about Ohio, probably not, but in some cities and some states like Arkansas, for example, on the report card, on the student's report card, they put the student's body mass index. So the body mass index is a measure of whether you're overweight or not. And they put that on the report card. And the idea there is that both the family and the school have a responsibility to teach healthy eating habits and to report back on the student's health. Now, you can imagine that that's somewhat controversial. And some parents have said that they don't want the school button into what their child eats. So it varies tremendously from jurisdiction to jurisdiction. And so some places have been very aggressive about that. And that there were a lot of movements to take the soda machines out of schools. And some of the soft drink suppliers have agreed to take out some of those huge sugary drinks, the Coca-Colas and the Pepsi-Colas, and replace those vending machines with fruit juices. But that varies across the board. We absolutely encourage schools to get involved, certainly encourage parents to get involved with the schools in doing that. And there's a whole division at CDC just on that one subject, which is school health and the health of students in schools. The second thing about vaccinations, I think, is right on the mark with what I was talking about at the end. And this is a very, very, very difficult issue. And so some of you may have heard about this on the news. There is a movement, in the through the 60s and 70s, vaccination and immunization was just a given. And everybody loved the idea of immunization because it worked. I mean, it cured, it prevented all these terrible, terrible diseases. For a number of reasons, people got a bit wary about immunization, but what's happened just in the last few years is that people have taken advantage of social networking sites, of the internet, of the ability to link with like-minded people all over the country, and there has been a movement against the use of some vaccinations in children because of concerns that if children are vaccinated very early in life, they have a higher risk of developing autism. And there's been an entire movement about that nationwide. Now, all the studies that have been done do not support the idea that vaccination in children has any relationship to autism. But what I was talking about before, in the power that individuals have, people don't trust experts anymore. They don't trust the government. And now it's not just one person sitting in her or his living room on their computer. They can reach out and they can link with people and start a movement. And part of the problem, and so here I'm going off script, but part of the problem has been that we have to listen to what people say. I've got some young women that work for me in my office who've just had small children. And they've read all the studies, and they know that there is absolutely no scientific link between immunizations and autism. But what they complain about is there are so many vaccinations now in young children that they're all squeezed into a certain number of visits to the doctor. And so what these folks who are highly aware of all the science are, they say, what's the rationale for why public health says all these shots have to be given? Because they don't like taking their babies to the doctor and getting all these shots. And so they've asked the question, why do all these shots have to be compressed into such a small time frame? Is there a scientific rationale for that? Well, that's controversial. There's a lot of things that go into that. But up until very recently, the scientific establishment, the public health establishment, hasn't really been willing to engage in a dialogue about why the vaccination schedule is what it is. And when you fall back on what I called that expert model, when you fall back on that model and say, well, I'm the expert, you just do what I tell you, people don't accept that anymore. And when you do that, it undermines people's trust in the government and its trust in experts. So one of the things that we need to start doing is listening to what people say out there, giving them accurate information, but we also have to hear when they don't like what's going on, and we have to engage. If we have good scientific reasons why those vaccinations have to be squeezed into that vaccination schedule, then we should convince people of that. But what we can't do is not engage in that discussion. And that's a huge change, even in the last 10 years.
Hello, my name is Felicia. I'm from the Cleveland School of Science and Medicine, and I have a couple questions to ask you. First, what made you become interested in public health altogether?
That's a great question, and I've told this story at my place. I was in medical training, and I thought I was going to be a hospital doctor and go into private practice. And it was, I'm revealing my age now, it was 1976. And what happens when you're an intern in a hospital, they have constant lectures. I mean, nobody ever sits down and just actually has lunch. You have to listen to a lecture during lunch. And so somebody came to speak to us, and the person that came to speak to us was a young guy at that time who had joined the CDC in July. You join up July 1st in what Caitlin referred to the Epidemic Intelligence Service. He was on the job for 2 days, and they sent him to Philadelphia